up, everybody? Welcome back to the Pain Sucks podcast. I'm Dr. Matt.
Dr. Justin.
Awesome. And so we're really excited today. We want to talk about something that's near and dear to both of us, but also something that we've been getting a lot of questions about, have a lot of people walk in with. We're going to really focus in on knee pain today. Yeah. To be very honest with you, it was when I was 19 years old that I injured my knee that led from one thing to another. Is the reason I became a chiropractor. And so a lot of people were like, what about back? What about your neck? And,
right.
and those things have certainly become issues at some point. But the knee, even early on as an athlete at 19 years old, is how I became a chiropractor. So yeah, I have a special interest in helping people with that.
Yeah, me too. Like, I played college. I played 3 sports in high school, college football, knee injury in college. Like I had my first surgery then. Survived it, went through it later on after I got out of college. More trauma, more knee pain, tried to avoid those multiple surgeries, was told I'm 40 years old today. Yeah. I was told I was going to have a knee replacement by the time I was 40.
Yeah.
Okay. It was just a multiple surgery type thing. And that's something I did not want to do.
Right.
And I figured out how to avoid it.
Right.
Like that, how to fix that kind of stuff. And it's something that people deal with all the time. They come in and whether it was an old injury that just kept nagging on like that, they're constantly getting questions on, what do we need to do, and how do I rehab this, and what are the best things for me to do?
Yeah,
okay, so we can go through a couple of them.
So to start with, when someone has a knee injury, I think there's a couple of standard things that people do. The first thing that I think most of us do is just wait it out and see if we can just get over it on our own. We don't do anything.
Correct.
We limp around for a little bit. We probably complain about it to everybody we know until they're sick of it. And then we do something. And usually that first level of doing something about it involves an over-the-counter something or other.
Well, that's what we've been taught our whole lives. You ice it, go lay on the couch for a couple of days, take some ibuprofen, should be better.
Right. And we did talk about ice last week and heat in our last Pain Sucks podcast, which we're grateful that you guys are listening and sharing. I thought it was a good one. We got a lot of good feedback. Go back and listen to it. And I think people do start with things like ice or an Advil or whatever. And sometimes those things take care of what kind of knee problems?
Those very slight, like more like a baby strain. You know what I'm saying? Like it's the acute. We've done a podcast on acute versus that chronic inflammation. And that very acute inflammation where it's a little swollen and it's hurting really bad. And that tends to knock that reaction down. So it feels better.
Right. And I think people are doing it all the time. They step funny off a curve. They twist a little bit funny or whatever it may be. There's a gazillion little things that happen to the knee that simple things like rest and ice and some, whether it's healthy supplement or whatever,
sometimes it works.
Handles it. But then you get into the other ones where maybe it's just still nagging and it's still nagging and it's still nagging. And now we're starting the process of maybe visiting the doctor. And then usually what happens is we get one of two ways that we go. We visit the doctor and we either go towards that medical route, right, which is...
Right. Steroid injections, cortisone shots,
physical therapy.
That's the initial reaction.
All okay in certain places and times, but the truth of the matter is most people just have this issue where they can't deal with it on their own anymore and they go that route. And so once you're sort of in that pipeline, that's just what you do.
Right.
And so one of the things we want to encourage people is if you're dealing with it, let's just talk about chronic at this point. You're dealing with a knee that's been there for probably anywhere from several months to years to even decades. There's a real issue going on with that anatomy.
Yeah, when you take that acute injury, and that initial pain goes away, your body starts that formation of scar tissue. Over time. Well, scar tissue really doesn't feel pain.
Right.
So if you just wait it out long enough, most people feel okay, but it's scarring over that joint, over, and that scar tissue becomes very weak. So it creates this chronic nagging issue of now I've got a weak joint that my body's compensating on. So we see patients all the time that come in and they're like, well, my knee's been bad for 5 or 6 years, but now it's my other knee, or now it's this hip, or now it's all these compensating things where we really never got that problem fixed.
Yeah, so at the lowest end, you could have just done something that over time has built up scar tissue and now is restricting the joint and causing it to just have to live life differently. And that in and of itself can be a problem. And then you've got another level of injury where perhaps years ago overusing it, or an athletic injury like yours that wasn't handled properly, perhaps you could go into some other tissues. Let's talk about those that could be damaged in the knee.
Well, all right. So in the knee, you've got the big four ligaments like
Right.
that: ACL, MCL, PCL.
Slow down,
and
do that
LCL.
again.
All right. So you've got four stabilizing ligaments that sit on top of that knee.
Right.
Right. Okay. So your anterior's in the front, the ACL. That's the big one we always hear about.
ACL, you hear about that all the time.
Okay.
Yeah.
The MCL is on the inside of the knee. That's the second largest one. Okay.
Yeah.
Those two together pretty much stabilize the knee.
Yeah.
Okay. You those two are the ones that are important. Okay.
Almost all movements of the knee.
Correct.
Yeah.
Okay. Your LCL lateral is on the
Right.
outside of the knee.
Yeah.
Your PCL is the smallest one, and it's in the back side of the knee.
Backside of the
Okay.
knee.
But it's a stabilizing. It keeps it from shearing back and forth. So when you need that, it's holding that knee together.
So you got four ligaments.
Yeah. So usually, unless there was a trauma, like an athletic type of trauma or something like that, usually those don't get torn. Like
Right.
they may get strained, or they may get stretched, or they may whatever. Most of the damage occurs in the meniscus. All right, so that's a popular word. Everybody knows what a meniscus is for the most part.
Explain it though.
But that is a padding, so your knee sits like this, and the meniscus is the thick padding that goes in between the joints. Okay, so it provides the padding between there. Okay? So as you move that joint, it's pumping fluid in and out of that joint, chronically lubricating it.
Yeah.
That's where those movement patterns come from. However, that meniscus is also loaded with nerve endings.
Yes.
Okay, so it's a very pain-sensitive structure. So over time, we trauma, scar tissue, and then it starts like tearing that tissue.
Yeah.
Okay, that's where most of the knee pain we see comes from, actually.
So a meniscus, like the ligaments,
Yep.
is very, very. It doesn't have a lot of blood in it.
Correct.
Right.
Correct.
So
More blood flow.
when it gets injured, it's a very difficult thing and time-consuming thing to rehab, and most people don't have the energy or the patience to do it correctly.
They do not heal well.
So
Plain and
meniscus,
simple.
a meniscus is a very easy thing to find. People
Yep.
come in, we poke around, there you go,
That's what it is.
right? And then of course so now you have the upper level things, which is the muscles that attach to
Right.
the knee, and then you've got the bones themselves.
Correct.
And together those four things create that joint. So there could be a lot going on, and yet really there isn't a lot going on.
Correct.
If you know how to look at it correctly.
Yeah, the knee's a very simple structure.
Yeah.
Like that, like compared to the rest of our body,
Right.
knees are very, very simple.
Right.
Like that. It's only a couple of things. It can
Yeah.
be this or it can be this.
You-
And then it's just to what degree, like
Yeah.
that, and how bad it is. Is it a very mild case? Is it a very severe case?
Right.
And that determines the treatments that you need
Right.
for it. Like, and how much of what? Is it going to take a long time to fix this, or is this a really easy fix?
Correct. And there are times that people walk in and there is a nasty tear. There
Yeah.
is a complete ripping of maybe one of those ligaments or this meniscus, and that's where we don't have any problems saying
Correct.
you go talk to an orthopedic. That's their world. That's
Happens
that's
all the
their
time.
wheelhouse.
Happens
Right.
all the time. Patients come in
Right.
and they go, "I want to talk stem cells."
Right.
Okay, like that. We're going to talk about regenerating that joint. We're going to talk stem cell injections, and we go, "Fantastic." We go over their MRIs with them. We go over everything with them and sit down and go, "Look, it's like not right now. Like this is not for you. You
Right.
need to go have this procedure done or this modality done or whatever it is and fix that one problem."
Right.
Because that's what they're great at.
Yeah.
Yeah. Then we can talk about the rest of the stuff and the actual healing of it.
So I just wanted to mention that because I think that sometimes people are like, no matter what, I'm not going to go see the doctor.
Correct.
There's a lot of cases where you need that intervention,
Yep.
you need that help. And then
100%.
after that, then that's where you have to do the things correctly, which is let's talk about that right now. So someone walks in and they've got an injury. A couple of things we know right off the bat. They're inflamed.
Yes.
So we've got to handle inflammation.
Yes.
We don't need to go into that today. They can go back and listen to the podcast we did on inflammation. That's where you're going to find your ice and your heat and your supplements and all those wonderful things.
Yes.
Let's talk about physical modality. How do we get joint structure, ligament, meniscus moving correctly?
One of the first things that happens is when that joint, whenever you have an injury, okay, that initial acute inflammation should last a couple days, okay, and then it goes right back down.
Right.
But as things adhese back together, okay, you lose mobility in
Yeah.
that knee, okay, and mobility in the knees is huge because it does not have a great blood supply.
Right.
So in order to get all of those great healing elements in and out of that knee, it's got to move.
Gotta move.
Okay, so we see so many of them that are so stiff and they're just kind of grinding. They can't bend on any way. So one of the first things that we can do, as a chiropractor, we're digging into those tissues. Like that, we're mobilizing that joint. We've got instruments that can do it. We can use our hands, and we've got all sorts of stuff. But we've got to get that joint mobile again to get some healing elements going in and out of that joint.
Correct. Now, we're not speaking right now to those of you with knee problems as we want you to start some heavy exercise
No.
regimes. We're literally talking about a person who is not you getting in there and beginning
Right.
to move those things correctly. If you've got scar tissue, breaking that up. If you've got knots, releasing those, if you've got muscles that need to be stripped free
Correct.
and told that it's okay for them to move right, those are very, very, very important things. Of course, one of the very first things you're going to see us do with anybody with a knee problem is immediately check the nerves coming from their low back.
Correct.
I am a chiropractor simply because I went that route of surgery and drugs and PT and got no relief because the nerves at the low part of my back, called the sciatic nerve roots, they were disturbed, they were damaged, they were interfered with. So no matter what anyone did to my knee, I was not getting any healing from my brain to the knee. So we're going to check a low back. We're going to make sure hips are aligned. We're going to adjust that knee. We're going to check that ankle. And then we're going to get in there and begin to manually move all those tissues we talked about at the beginning.
Well, and the other way that that's so important is with your gait.
Yeah.
Okay. Almost always on a knee injury, like we're not walking normally anymore.
Right.
Okay. So we're putting all weight on one side of the body versus the other one. So like the hips and pelvis, like that where it meets the low back, and all of those nerve endings, and all like your hamstrings and your quads and all those muscle groups.
Right.
Okay. It's so important to release them and to get them mobile again so that knee can function.
Correct. So some of the things we want to break down here in the next couple of minutes is what is someone like what an office like ours, which is kind of unique. We have all these different ways to approach it. Like what would we do for someone? And then we'll end it really quick with what they could do at home. Although we've got podcasts on what you should be doing at home. Let me just apply it to the knee. Someone walks in, you've mobilized it, you've had that talk with them about handling this inflammatory process at home and what they can do on their own. What are you going to do now?
So let's go low level to high level.
Right.
Let's say super simple, easy case. Like that, they come in, we work on it, we mobilize it, and then we're going to use a pulse wave machine on it.
Yeah.
Okay. I've got a pulse wave machine combines. Most people know what a TENS unit is, like that, where you put the electrical
stem
on there, like that, and it's for pain and inflammation. Nothing wrong with that. Pulse wave unit is a super cool unit, honestly.
Yeah.
It's the coolest thing ever.
Yeah. And
it combines acoustic style ultrasound waves.
Okay, ultrasound.
That drives deep into a joint. Their purpose, ultrasound's like a deep heat. Okay.
Right.
So it's gonna break up the scar tissue and break up any tissue in there, and it's gonna bring blood flow, dilates blood vessels.
Right.
So it's gonna rush those healing elements back in there. Whereas the electrical part of that stem goes in and it hits the mitochondria. So in that dead scar tissue that's just kind of there, we want to reactivate that healing mechanism.
Right.
Okay? And that's what it does. So it combines those two elements. So in very simple cases, we work on it manually, we use pulse wave on it, and they're good.
Yeah.
Okay. So is it a matter of, it takes 6 weeks to heal ligaments, like that, soft tissue, stuff like that. Okay, on a very, very simple case. Like that. So you're doing that several times, like that, done. Most people are okay with that.
Right. And through that process, we want to talk a little bit about stabilizing. So we're going to have you doing things like VMO exercises, which is a part of the knee that typically most people are very weak, which puts a lot of pressure on your hamstrings and get very imbalanced. We're going to help you start to begin to strengthen that. We're going to get all over your case about making sure you're doing some stretching and you're releasing things.
100%. It is so important. This is what we tell all of our knee patients, is that no matter what it takes to do this, the PT, the retraining part is a given.
Yeah.
It has to happen no matter what you're doing.
Or we're going to do this again.
Correct. It's just going to go right back.
But
you have got to do. So we send them home with exercises because literally one of the things that occurs when you have a joint injury is that it's not even about losing strength. Well, you'll talk about it and be like, my knee's weak, my leg is weak. Okay. It's not that it's weak. It's literally that the signals between your brain and that knee can't communicate anymore.
Right.
So it's literally that it forgets how to work properly.
Right.
Okay? So we're not trying to build strength again. You're doing those exercises because you're trying to retrain the joint how to move properly.
So at the very least, in really any injury, we're going to start with this. We're going to be involving this pulse wave machine, exercises, adjustments, manual movement therapies that we're going to do here in the office, and then having you do certain things at home. And then as we gradually maybe get a worse injury, instead of talking through these, but if it's a ligament or a really bad meniscus, what other things can we do here?
All right, so let's pretend that it's maybe a very slight tear,
Yeah.
or we think the meniscus is involved, or it's a really bad strain.
Yeah.
Pulse wave still applies.
Yeah.
Manual manipulation still applies because we've got to mobilize it. Then we jump into that world of the regen med. Right. So we talked about it, the stem cells and all that kind of stuff. Well, the low end entry of that is platelet-rich plasma, PRP, or the VD product that we use that replaces it. It's 100% concentrated growth factors. Right. So this is for a joint. Minor damage, maybe minimal damage, definitely not surgery, definitely not stem cells, definitely not any of that. So you put those healing elements into a joint. Okay? After you work on it a little bit, healing elements go in to like really start fixing that joint. Then you continue with the physical therapy stuff. Okay, so now not only are we training the joint, but we're giving the joint those growth factors to be able to put in there.
Love it. And you guys can go back and listen to that, because I guarantee what he's about to tell you, you are going to want to go back and listen to this.
Yes.
Because now people will walk in, and for 20, 30, 40 years sometimes, they have beat the crap out of themselves, and this is what we hear. Doc, I already know I have arthritis, and I'm thinking it's probably already bone on bone. So before you answer that, let me summarize one thing. A lot of people are listening. We've touched on their hot button right now. So they're like, yep, that's me. I got the pain here below my below my kneecap right here. Guess what? It's a scar tissue. It's a little bit of a ligament thing. You need to come and get that checked. I got something on the outside. I got something on the inside. There's something behind. There's something So the question is, are you just the simple, or are you all the way to where we are now?
Correct.
And so people will walk in, and the very first thing we're going to do in those cases, we're going to take a picture of it if they don't have one.
Absolutely. The term bone on bone gets used a bunch.
Too much.
Yeah, way too much. Okay, so patients come in all the time and they go, I was told I was bone on bone. I've been told that for years.
Yeah.
And we x-ray them and you go, it's not bone on bone.
Yeah.
And it's not bone on bone.
No.
And try, like not talking about anybody, but I find that that's just a way to push people aside.
Yeah.
Okay, and you go, there's nothing we can do for that. Bone on bone, go.
Right.
Okay, do that. And it's like, that's not true. There's a lot of healing that can take place there. Okay,
Yeah.
like real bone on bone pain, like those people aren't walking in here for the most part.
It's so miserable you see stars.
Yeah, like that. So we hear that term all the time. So we're going to x-ray. We're going to take a picture of it, and you can do measurements. Like there's literally measurements that you can do on there and go, look, this is not bone on bone. Here's where the dysfunction is. Here's where the damage is. This side might be fine, but all this might be damaged over here.
Yeah.
Okay.
And if we see that, years of damage and arthritis in there, what's the next level?
So the next level is the real stem cells, like that, the true Wharton's jelly umbilical cord cells. So we could do everything that we've already discussed,
and we will.
Yeah, we will. Like that. So this is a building block thing.
Right.
Okay. So at no point you just go stem cells. Have a great day.
Right.
Okay. You go no. Stem cells are the top add-on. And then you still have to do everything else with it.
Right. If you want to heal.
Right.
Yeah.
Okay. If you want that ultimate healing, and it's not an overnight process.
Right.
Like that. This is going to take 6 months, 3 months, 9 months, a year to do what it's going to do. But you're also regrowing tissue in there that's been missing for a long time, and it's phenomenal. But when patients come in, we do that stem cell consult with them. Like that, we can take them through that, and you go, okay, look, here's the protocol for this. It's going to take a while. We're going to do stem cells. We're going to do the rehab on it. We're going to use pulse wave on it. Here's your physical therapy layout. Here's your plan for the next 6 months.
Right.
Okay, to make sure that they're going to get the healing they want.
I love it. And so, again, you're going to go back and listen to that other podcast on the regenerative medicine if that's you. But one of the things I wanted to bring up before we close this thing out is just simply that too many people are walking in and thinking that things are over because their knee hurts, and now they'll never exercise like that again. They'll never walk like that again. They'll never be with their grandkids like that again. And I want you to understand that in America, we're very, very, very good at really emotionally driving people to this thing where like you're just old and you can't have anything good again. Right. But we know that that's not how God or the body works.
Don't like the word old.
So, yeah.
Do not like the word old.
Right. And so as the knee goes, you could come see us with a million different names that you've been given. It comes down to a couple things. It's inflamed.
Yep.
It's not moving. Correct. It's probably scarred up. It might have some tears and stuff in it, and we just go through the process. And it's just going to take some time and some effort if that's what people want to do.
And it goes back to the sheer fact that the knee is a very simple joint.
Very
simple joint. So you go step by step by step by step. It's not this incredibly hard thing to figure out where you've got all these millions of factors involved with it, and you go, no, look, we're going to start at step 0, and you go step, okay, until you get through that step, and it fixes almost all of them.
So when someone's listening to this and they go, I've done that. What are you going to tell them about buying to themselves right now? They haven't done it all.
They didn't do it. Like with the results we see and how it works, like that. If it's done properly and they follow through with those steps and everything else like that. Like I said, almost every person we talk to, even like we have patients that come in and do stem cell consults that have had a stem cell injected in their knee, and they're like, it didn't work. but they skipped steps like 2 through 4
Yeah.
like that, to get there. They just walked in there, they took Advil, they got a cortisone shot, waited 2 months, got a stem cell put in, and then a year later they're like, I don't think it worked very well.
Right.
It's like, you missed all the steps.
Yeah, there was so much in between that we missed. And that brings me to one last thing. Those of you that are dealing with knee pain right now, I will guarantee you that right now you have a low back problem, you have a hip problem on one or both sides, and you also have an ankle problem.
Gotcha.
And so if we don't look downstream and upstream at those joints at the same single time, then we're going to lose, because those muscles are all connected to those joints.
Sitting to standing, like that, it affects it tremendously. People are like, I can't get out of my chair.
Right.
Like that. I sit down for a minute, I go to get back up, hurts.
Right.
Going upstairs, going downstairs.
Yeah.
Like that. All of those are kinetic chain injuries.
Yeah. And so they have to be looked at, which is what we want to try to do. So we're hoping that like you've listened to this and you sort of can, maybe even where you fall in this. This is one of those where it's like we would love for you to reach out and ask us questions, but the truth of the matter is, if you're dealing with things, you really just need to come in here.
Let's do it.
And so, we'd love to help you with that. And we want you to go back and listen to some of the things we've done. We're trying to put these out there for people. Come experience that pulse wave. It's really life-changing. And you too can heal. Both of us are testaments of being told your knees are beyond gone, where we're still doing life at a high level. So anyways, guys, have a wonderful day. Remember that nobody, and we mean nobody, gets to tell you that you can't heal. Be blessed. I'm Dr. Matt.
I'm in, guys. I'm Dr. Justin.
Have a great